For a child that has a cleft lip and palate, teeth development generally tracks maybe about a year on the average, or a year and a half sometimes, when compared to their age cohorts. So that's number one. We may expect that the timing of teeth development may be a little bit lagging. And for children with cleft lip and palate, the actual cleft damage to the alveolus, which is the jaw segment, more often than not damages tooth buds. So there is very, very likely that there will be missing incisor teeth. And missing incisor teeth obviously complicates the long-term alignment and fit of the top to the lower teeth. We also very often will notice that the teeth, especially the central incisor that is located right next to the area of the cleft, is also malformed. The enamel, which is the outermost layer, it's dysmorphic, meaning it's not formed properly. The root of this tooth is also more often than not less robust, and ultimately these factors have to be taken into consideration when the time comes for orthodontic alignment and orthodontic planning. Having a cleft will also affect the growth and development and projection of the upper jaw, called the maxilla. Having multiple rands of scar tissue from surgeries can often limit growth and development. Having fewer teeth will also reduce the length of this upper jaw. So the tendency for a majority of patients, even when the lower jaw is normal in development, is that the upper jaw is underdeveloped. If there are fewer teeth, the likelihood then is that the child will develop an underbite, called a class 3 malocclusion. And all of these factors will need to be addressed in first, second, and sometimes a third round of orthodontic and surgical correction.